Every year, across England and Wales, around 1,000 people aged 65 and over are admitted to a specialist burns service for treatment of a burn injury. Many more people are treated in emergency departments and minor injury units. The majority of these burn injuries are accidental and occur in the person's own home, sometimes in the bathroom. Scalds, caused by hot water from the bath or shower, are the most common, followed by burn injuries caused by contact with a hot radiator or towel rail. Older adults are less likely to survive a big burn injury. They have to stay in hospital longer for treatment and rehabilitation, and are likely to require more follow-up appointments for dressing changes and scar management. However, by taking a few reasonable precautions, the risk of sustaining a burn injury in the bathroom can be avoided. Here are some tips from our burns expert. Get your heating, hot water storage and distribution systems serviced by a professional plumber annually to make sure that they are meeting safety and efficiency requirements. Consider getting thermostatic mixer valves fitted by a plumber to safely regulate the temperature of the water coming out of your bath taps or shower. If this isn't possible, always run the cold water first and add warm water to reach the required temperature. Check the temperature of the bath with a thermometer before getting in, especially if you have a medical condition that affects the sensation in your hands or feet, such as diabetes. It should be below 43 degrees Celsius. Consider installing a grab rail and non-slip mat to reduce the risk of slipping. A shower stool or chair can be useful for those who find it difficult to stand for long periods of time. A fixed shower or bath screen can make it more difficult to remove yourself from hot water. A movable screen or shower curtain is much safer. Consider installing low surface temperature radiators or radiator covers. Insulate any pipes which get hot and are situated at a low level. Even if we do everything possible to reduce the risk of injury, sometimes accidents still happen. Knowing the correct first aid and applying it quickly within 3 hours of a burn can reduce the seriousness of the injury. Here are 3 simple first aid steps to remember: cool, call, and cover. These actions, performed within 3 hours of sustaining a burn injury, will reduce pain, swelling, and the risk of complications which cause scarring. Cool. Firstly, remove any clothing and jewellery from the burn area unless it is stuck. Cool the burn under cool, running water from a tap or shower for at least 20 minutes. As well as providing pain relief and cleaning the wound, this minimises swelling and stops the burn from damaging the deeper layers of skin. If it's not possible to cool the burn under running water, reapplying clean cloths soaked in cool water frequently is also effective. Once again, they should be applied for at least 20 minutes. Only cool the burn area, not any other parts of the body, and ensure the injured person is kept warm if possible. Call. Call NHS 111 for advice on any burn larger than a 50p piece or if there are any blisters. NHS 111 will give further first aid advice and may suggest that you go to your nearest minor injury unit or hospital. For more serious burns, call 999 for emergency care. Cover. After the burn has been cooled for at least 20 minutes, cover the wound with loosely placed cling film or a sterile, non-fluffy dressing to ensure that it remains clean. This will also help reduce the pain. Don't apply any creams or other products to the wound without medical advice. Unfortunately, despite our best efforts, accidents can still happen. But if you are prepared and remember to cool, call, and cover, you can reduce the impact of a burn injury and ensure better recovery and outcome. If the wound is not healed within 2 weeks or there are signs of infection, seek further advice from your GP, NHS 111 or minor injury unit. Suspect infection if your wound is worse and you feel unwell with a high temperature above 38 degrees Celsius. Please share this message with your family and friends. Burns can happen to anyone, whatever their age, and cool, call, cover is the best first aid that can be given for the majority of burns.